Hi, everybody. I'm so excited that you could be here with me tonight to talk about the geriatric cat. The shiny new kittens are so much fun, but as we live a whole life with a cat, they're just so special to us. So I want to know about your cats and I want to talk to you tonight. So join me in the chat and in the comments and let me know what's going on with your cat. Now, we've only got about 10 minutes, so I wanted to get right to it. We say geriatric cat, but what does that even mean? So we have broken the life of a cat into stages. And by we, I don't mean me, I mean veterinarians, the American Association of Feline Practitioners. And we divide this up into ages so that we can figure out, sort of as categories, when do we need to do things a little bit differently? And for the older cat, the geriatric cat, that line in the sand, in the kitty litter, if you will, is when they're 10 years old and older. So the average lifespan of a cat is about 1/5 the lifespan of a human being. So what that means is that cats are aging much more quickly than we are. And so, 1 year to us is a whole lot less to a cat. It's a couple months when they're very old. So as they age, that 1 year checkup that we were doing for them as a kitten and a young cat really needs to be every 6 months so that we can stay on top of changes and really make sure we're taking care of them. And when they're 15 years and older, that needs to be every 4 months. Things start to change fast. And if we want to give them the best quality of life that we can and be on top of those changes, we need to see them more regularly. So I'm working some tech magic here. Hang on with me. All right. So in older cats, what do we see? What's happening out there? And you guys know this because it's what you're seeing. All of a sudden, the cat that was really active and greeted you at the door and was playing around all night, they're sleeping more. They may not meet you at the door. They may not climb the stairs like they used to. And that meowing and talking might become more and louder, particularly at night. You can see changes associated with movement. Like I said, they might not be using the stairs as much. They might not be jumping or even missing when they try to jump up onto things. And at this point, litter box sides become a real barrier. So they may not be able to get in and out of the litter box like they used to. We also can see changes in their hearing and their sight and smell and taste. So all the senses are starting to be affected. And that sense of smell and taste has a huge impact on a cat's desire to eat. So we might start to see them lose weight as a result of that loss of taste and smell. And these are things that we can really do something about. We can also see loose and even very fragile skin, brittle nails, or nails that are growing really fast. And then we see GI changes where cats can have a decreased ability to absorb their food, and they have an increased need for protein. So in short, that means that we need to go to the vet more often. And I want you to make the most of your veterinary visits. I can't tell you how many times I, as a vet, thought that I answered all your questions and everything was great. And then I would hear from you later, oh, I wanted to ask you this, or you send me an email later about that. And that's fine. But I'd really rather talk to you when we're face to face. So before your vet appointment, or you can even keep an ongoing journal, writing down your questions and concerns. So when it comes go time and we're face to face, then you've got it all right there and you're not going to forget anything. If we're new to one another, bring your vet records from any previous vets, any tests that you've had, that your cat has had. We want to have all that information so that we can make appropriate choices going forward. Speaking of appropriate choices, bring any medications or supplements that you're giving your cat. If we're going to change things, if something's going wrong, if something's going right, we want to know everything that's in your cat's diet. And that includes the medications and the supplements that are going in or on your cat so that we can be sure we're doing everything safe And the thing that's great if you bring them instead of just write them down is they should have a medication label, and then we'll have the dosing and all of the most current information. It also helps if you can write down what food you're feeding, how often, and how much. And if you can include in that treats and human food, don't play the shame game. We need all the information to make sure that we are coming up with a complete healthcare plan for your cat. And finally, carrier training. Now, I hear so often that ride to the vet is really hard, and that's what keeps a lot of people from coming. So if you get a carrier that your cat really loves to sleep in, and leave it out all the time. Put treats in there so that your cat now associates it with fun, nice things and not scary things. Every now and then, you can even shut the door and leave your cat in there with a treat so they know it's not scary. Then maybe you can walk them around inside the carrier in the house. Then maybe even go for a ride just around the block and come back. And when you incorporate that carrier into not scary things, the day that you have to come to the vet, is that whole process is so much smoother, and your cat won't get all wound up, and it'll be better and easier for everyone. So back to my tech magic here. Look at this. Awesome. So when you get to the vet, what's going to happen? Well, we can do a lot of things, and it might not look like we're doing much, but we're gathering a lot of information just on our exam. So we're going to get the cat's weight, and we're going to compare that to their previous weights and see if there's changes. We're going to look in the whole oral cavity. As cats age, it's not just their teeth that we need to make sure is healthy. We're looking at their gums, the back of the throat. We're looking at their tongue. We're looking underneath the tongue and making sure the color is what we want and normal, and that there's no growths or anything that is worrisome. We're going to check in the eyes and the ears. We're going to feel their throat for the thyroid gland. We're going to listen to their heart and lungs, and we're going to get a really good feel of the abdomen to feel all of the internal organs of the cat. We also want to take a good feel of the muscles and joints and see if we have any muscle wasting or if there's any joint pain. We're going to check the lymph nodes, and we're going to make sure that that coat looks good. Often we see things in our cats just in the coat that give us some clues that things aren't going right. So we want to look into all of what we can see and feel, and what you brought us with all your information and the history. And then there's a lot we have to talk about. So we need to talk about vaccines. Some of them are recommended by, or are required by law. Some of them are recommended under different circumstances. And we really need to work as a partnership to figure out what your cat needs and what you might be able to safely skip. Now, are you thinking maybe I'm going to get a new kitten, or maybe if I find a rescue, I'm going to bring it home? That changes things, and we need to make sure that your geriatric cat is safe. We're going to talk about parasite prevention. Is your cat going outside? Are they having any exposure to fleas? What about mosquitoes? We want to talk about all those things. It really is recommended to get a blood and urine test in these geriatric cats at least once a year. And we're going to want to see how things change over time. Sometimes that one value is information, but it's not enough information to make really good recommendations with. And when we see trends over time, are things stable? Are they going up? Are they going down? That really helps us to make the right decision for how we're going to treat your cat. And we really want to communicate well with you. These years for your cat are so important. And I know I do, and I'm sure your vet wants you to feel comfortable talking with them and getting your question answered and feel like you're being heard and your concerns are being cared for. It can be kind of like dating, like chemistry. If you're not clicking with your vet, you don't feel comfortable asking questions, it's reasonable to look for a different vet, or get a little braver and say, I really want to talk about these things, or find a way to communicate with your vet through email or something to make sure that you're getting your questions answered and you feel that you're being heard. We really do care. We want that for you. And if you feel like, well, I haven't had a great relationship with my vet, or I moved, or I haven't gone to the vet. This is a great resource. If you go on catfriendly.com, you can go to find a vet. Now, these vets who will come up in this search, you just type in your area, and these vets have taken extra courses to become cat friendly certified. So they've gone that extra mile to make sure not only do they know their medicine and surgery like every veterinarian will, but that they know how to make your cat feel most relaxed and most comfortable when they're in the veterinary hospital. And if we can do all of those things for you and your cat, we're going to give your cat the longest and the best quality of life. So I hope you learned a lot tonight about how to take care of your geriatric cat. And there's going to be more. Every Tuesday, I'm going to be back and I'm bringing friends. I'm bringing the most famous, educated, amazing, entertaining, wonderful veterinarians who really focus on cats. And they're going to be joining me every Tuesday night. There's going to be someone new each week. And we're going to talk about what you want to know every Tuesday for senior cat care for the whole month of November. And then stay tuned and see what we're going to do in December. If you have questions or there's something that you want covered, let us know, reach out. We want to hear from you. So tonight, give your geriatric cat an extra cuddle for me. And I can't wait to see you next Tuesday. Thank you.